So these types of disparities, as well as the disparities in healthcare overall that affect minority communities mainly, they're very complex, right? So we first have to recognize the factors that contribute to these disparities, such as biases, whether conscious or unconscious, based on gender, race, socioeconomic status, education level, and other social determinants of health. Then we have to consider access to care, which is something that I've named in previous answers. Are these patients able to afford this care? Is there a facility within the patient's geographic area where they can seek treatment? And lastly, we must consider the availability of professionals within the healthcare system who are specifically trained to provide proper care for these diseases such as sickle cell. So I think once we recognize all of those factors that contribute to the disparities, we can then keep these types of conversations going like I'm having right now, as well as begin to work on solutions, which include policy changes, continuing education on treating a complex disease such as sickle cell, as well as more implicit bias training, cultural competence training, and empathy training. And additionally, ongoing research for better treatments that will be able to reach more patients. Um, and after that, next steps would include adjusting our future behaviors based on the education provided, as well as engaging in ongoing critiques of our behaviors, attitudes, biases, um, and patient feedback, and self-reflection. One more thing I wanted to add is that healthcare professionals should work collaboratively with one another to ensure that this kind of checks and balances system is in place when evaluating treatment plans for this disease. So for example, when I sought care at the UIC, University of Illinois, Chicago Sickle Cell Clinic, after I had a major sickle cell crisis, I was seen by a pharmacist first. And so she asked me about, what my medication regimen was, how I typically manage my pain at home, and, just other things in terms of other disease states that I've had. Then I saw another member of the healthcare team, the nurse practitioner, as well as a social worker and a representative from the physician team. So they evaluated all aspects of my healthcare that contributed to this vaso-occlusive crisis. Because generally, I'm a sickler that doesn't have crises as much as other sicklers because we know that there are different types. So they're, coming together as a collaborative team to figure out why this happened and to give me resources on how to prevent further crises. And they offered additional support in terms of maintaining my mental health and, like I said, prevention of further complications due to vaso-occlusive crises. And one more thing I would like to add. So I've been working with other people in terms of getting this idea of collaborative care and taking people's pain seriously, especially when it comes to narrowing the disparities between minority patients. So I just want to shout out to my colleague, Randall Noble at the University of Chicago that I work with. We did another podcast about disparities in pain treatment in healthcare. So it was about non-cancer related chronic pain. And he actually wrote an article entitled Treatment Disparities Among the Black Population and Their Influence on Equitable Management of Chronic Pain. So if you guys Google that and read that article, he offers some pretty helpful hints on how to provide solutions to help end these disparities.